It's October 15th, and this is a day for opening up. This is opening up registration. This is a time for you to change your plan. Medicare Advantage, there are plans that are increasingly popular, and so Ian Hoke is on location at People's Health, Veterans and Causeway in Metairie with benefits advisor for People Health, Mike Knight.
That's right, Scooter. I'm here with Mike Knight. Say hello, Mike. Thanks for making time today.
Hey, thank you for having me. How you doing?
I'm doing very well, thank you. If you're just tuning in, we are live at the People's Health Medicare Center in Metairie. Today is the beginning of Medicare's annual enrollment period. And before we dive right into that, Mike, for people who don't know or aren't familiar or haven't been listening so far today, what is People's Health and what is it that you do exactly?
All right, so People's Health, we're a Medicare plan. We've been around since 1994. We cover 110,000 people in Louisiana, and we do everything Medicare. So if someone's coming on to Medicare and they're looking for a Medicare Advantage plan, if they have questions, if they just need to know where to start, we're a good place here to come and do that.
Okay, great. I did wanted to note for anybody, I'm not quite at the age where I would need Medicare, but I know there's a lot of people listening who are used to helping their parents set up their computer or install their Roku machine or something like that. So we want to make sure if you're like me and you're not quite near the age of eligibility, you still want to pay attention to this because this is really useful information for you or somebody else in your family when it's that time.
Yeah, absolutely. We had somebody come in just maybe 10 minutes ago that was getting information for their parents, and we're all going to be at that point sometime. Mm-hmm. So hopefully we all make it to 65 or older. But it is good to start looking at that, and definitely as people get older, they're going to need help. So it's good to be knowledgeable.
Great. Let's talk about this annual enrollment period kicking off today. What does this mean for people who have Medicare?
So this is your time of year where you can join a plan, you can change a plan, you can consider other coverage. This is kind of the time of year where you're going to decide what your health care is going to be for the next 12 months.
Mm-hmm. Okay, great. Yeah, just like if you even have private employer insurance, you always have this period where you got to make changes here, or if you need to add a beneficiary or something, it's the same thing.
Exactly.
Okay,
same concept.
And so tell us about some of the kinds of changes that people would traditionally make during this period.
All right. So if they don't have a Medicare drug plan, this is the time of year they could add one. If they're on just regular Medicare and they wanted to pick up a whole package, like a Medicare Advantage plan, they can come and do that. If they wanted to drop coverage, this is the time of year where you can add or delete coverage.
Yeah, okay, great. And people can make changes other times. This isn't the only time, but there's certain eligibility requirements, certain circumstances that have to be in play if people want to make changes to their plans outside of this 2 or 3 month period, right?
Correct, yeah. It's called the special election period, and it's not everybody's going to qualify for it, so if they do, it's going to be per individual, and where this is the time of year where everyone can come in and just make a change because they want to. They don't have to seek a certain period.
Yeah. So I want to make sure we highlight what we're really doing here is trying to save people money, right? This is all about, people who are on fixed income. They really need to save money on health care with groceries and gas and insurance and everything else the way it is. People's Health can really help people sort of bend down the cost curve. So tell us about some of the ways that people can lower their Medicare costs, particularly through these Medicare savings programs.
All right, so the Medicare Savings Program is going to be an asset-based and an income-based program. It's through the state of Louisiana. And what they can do, if they qualify, they can contact the state of Louisiana and say, hey, look, I'd like to apply for Medicaid. And there's various levels of Medicaid that they can qualify for based on their income. And what they would do is once they go through the application process, the state of Louisiana would say, okay, this is what you qualify for. Once they figure out what they're qualified for, we have special needs plans that they can come in and see if it's going to fit their needs.
Okay, so how can people find out if they are eligible?
Calling the state of Louisiana would be the first one.
Just make a phone call to...
Yeah, Louisiana. So what they would do is they would call Department of Health and Hospitals, and it's Louisiana You want me to give you the number?
Yes, please. Okay. Go ahead and rock that right if people don't have it handy.
Sure, it's 888-342-6207, and that is Louisiana Medicaid. There's also some local contacts through the Senior Health Insurance Information Program of Louisiana that they'll have them stationed in each parish, and they're real knowledgeable. They'll help them fill out applications as well, or the local council on aging a lot of times will be able to help.
Okay, great. Let's talk about prescription drugs. I don't take a ton of prescription drugs, but I've just kind of crossed the threshold where the costs are now starting to stack a bit, and I know for people who are seniors and are taking lots of prescription drugs, that can be a big burden. Explain the Extra Help program and how that can help people out with their Part D coverage.
So Extra Help is a program through Social Security. So the first one we were talking about is through the state of Louisiana. This one's through Social Security.
This is Social Security, okay.
And so it's still income and asset based, but it has a higher threshold. So their income can be a little bit higher than what they are qualifying for under Medicaid. And what it does, it just helps lower cost. So some health plans will have drug premiums, and it'll help eliminate those. It'll help push down their co-pays for medication, so they're not paying as much for the medicine. If they have what's called a late enrollment penalty, if they didn't sign up for Medicare Part D when they were first eligible, it will cover that penalty for them.
Yeah.
So it's another benefit, another way to help reduce cost.
Okay, great. Let's take this moment just to remind people there is a brick and mortar store here where they can come and talk to an expert. There's a learning program, a seminar happening in the other little room right now. And I think you and I actually spoke briefly last year when I was at the studio, and I had an opportunity to read some of the text messages that were coming in, and somebody pointed out how special it is that there's a facility like yours that can help people in the most human to human contact way possible come to face with this kind of big technical red tape bureaucracy, and you make it all so much easier for them, and you can do that speaking to a real human person to person, and that is so special.
Yeah, in New Orleans, we tend to like to do things face to face.
Sure, yeah.
And here, this is special because you can walk in, you can talk to someone. I spoke to somebody earlier today who enrolled over the phone with a different plan and got all the information incorrect.
Oh, no.
And so, that's what I said. It's nice to be able to come in. You can see what we're writing down. I mean, you can see what's written down. You can read it. You can ask questions and get your answers without trying to just do something over the phone.
Sure. I do see some texts coming in here on the Oakland Art Jewelers Talking text line. If you got a question you want me to tuck in with Mike Knight real quick, shoot me a text, 504-260-1870. I'm getting some of those ready now. We'll get to those in just a moment. Going back to Extra Help, tell us what that application process is like.
There's a couple of ways you can do it. You can do it online with Social Security. You can go to a Social Security office. You can call them on the phone. Also, with the SHIP, the Senior Information Programs for Louisiana, they will help you do it as well.
Okay.
The Council on Aging also.
Yeah, great. All hands on deck. Everybody wants to help.
There really is a lot of resources.
Okay, great. So there are people who qualify for both Medicare and Medicaid, and those are dual eligible people, right?
Correct.
So how do these dual eligible special needs plans, how do they coordinate their coverage?
So if they come onto a plan that People's Health offers, that's a dual eligible plan, we're going to see what they qualify for with Medicare, also what they qualify for with Medicaid, and then they have enhanced benefits. So they may be getting an over-the-counter card that includes food, ability to pay certain utilities.
Wow.
And then, over-the-counter items, cold remedies, vitamins, Band-Aids, that type of thing, all included.
Yeah. So it's not just, inpatient care, the sort of big elaborate things we think of when we think about healthcare. It's also just day-to-day things, like you just meant things you can pick up at the pharmacy.
Right, and all those things tie back into their overall health.
Sure. And for people with more complex health needs, tell us about how People's Health helps members navigate the different Medicaid and Medicare benefits.
So we have people on site the care coordinators that will, if you're part of a special needs plan, you have a care coordinator. And what they're designed to do is really just help you either manage any health conditions, manage the health plan, make sure you're getting the care that you need.
Okay, so just to reinforce for people, if people are interested in applying for these Medicare savings programs or the Extra Help program, what should they do right now? What should they do today?
Today they should call, if they're looking for Medicaid, call Medicaid and say, I would like to apply. They're going to take an application whether they think you're eligible or not, because as they're going through, they're going to ask you all the information. That person you're talking to on the phone is not going to make the decision. They feed it in, and then a determination is made, and they mail you a letter about it.
So it could be really quite straightforward if somebody's listening and they think, maybe I'm eligible for some of these benefits. All you got to do is make one phone call.
Correct.
It's not like you got to go do this elaborate back and forth with somebody. You talk to somebody that's going to be helpful and knowledgeable on the phone, and you explain to them what your situation is. They get the information they need, and then they get back to you and say, hey, these could be your benefits if you'd like to enroll.
Exactly. Right.
Okay,
Yeah.
that's great. For people who want to learn more about People's Health, or they want to come to one of these seminars, you must do. I know you're not just doing this today. You must do these all the time.
We
right?
do, yeah.
So where do people see like a schedule or what the topic of a certain seminar is going to be?
So they can go to peopleshealth.com/center, and that'll have the whole schedule coming up. And we're going to be doing them all the way through annual enrollment. They can also come in here, and I mean, we can do a one-on-one with them. They don't actually have to be in any kind of a meeting. They can also call the center here and schedule and reserve a spot for a meeting.
Okay, great. So even for people, like I said earlier, geographically speaking, this is kind of
Come on by.
right in
Yeah,
the
there's
heart
no
of
reason
Metairie. It's
not
easy to get here, but even for people who aren't able to come over here quickly or take time off work or however, they can just make a phone call, right?
Yeah, they can call us, and we do home visits as well. So
Do you really?
We can go out and
Wow.
meet with them.
That's incredible service.
So, yeah.
And it begs the question, why aren't there more organizations like this one that help us deal with, everything that we have to do with the government is such a pain. And I just wish there were more organizations like yours that were able to just, hey, here's a chair for me, here's a chair for you. Let me help you navigate this complex system. It seems to me such a no-brainer. I'm just so glad that People's Health exists in this capacity because I think people need help with all kinds of things, and they don't get it.
Yeah, and a lot of it's just getting questions answered. Is this right for me or not? And here's what's important to me.
Yeah.
And if we can cover that, we'll tell you. If not, we're going to tell you that as well. This isn't right for you.
Yeah. Fantastic. Anything else you want our audience to know before we let you go, Mike?
Yeah, well, we're here Monday through Friday, 8 to 5.
Fantastic. I want to see if I can tuck in a couple more questions here. These are from the Aucoin Hart Jewelers Talk and Text line. Somebody says, I'd like to know why there is an enrollment period. It seems like not everybody turns 65 at the same time of year. Why can't I sign up in April or August or May?
Good question. If you're aging into Medicare, you can sign up at any point when you're aging in. So that's going to be what they call an initial election period, where they're just becoming eligible for Medicare, or if they're leaving work. If you have some kind of a life change, you may have an election period there available.
Right.
This is for people that are already on Medicare and just continuing on with what they're doing.
Yeah, so going back to what we said earlier, and it's from October 15th to December 7th?
December 7th,
Okay,
correct.
so even if you need Medicare, sometime outside of that, you may be able to go to one of these special
That's
things
correct,
and
yeah.
okay,
If you're
great.
aging in, or if you're just signing up for Medicare because you're retiring, there's all kind of different special election periods.
Very cool, very cool. Anything else, Mike?
No, thank you for having us.
Thank you. Nice speaking with you.
Likewise.
Mike Knight is a benefits advisor with People's Health, a United Healthcare company. I'm out here live on Veterans Boulevard. We'll be here until 4 o'clock. We'd love to see you. We're out at Vets near Causeway. We've got Medicare experts standing by to help you make this very important decision. They're explaining Medicare, Medicare Advantage, and the annual Medicare enrollment period, all the challenges and opportunities therein. Scoot on the air. Back to you, my friend.